Series 1501, Chapter 1501.101, Swine Flu. A presentation brought to you by Savitri Free Global School from Ajmer. Presenter Dr. Anup. In this presentation, we will see what is swine flu, who gets it, what are the symptoms, how to prevent getting swine flu, how to prevent spreading swine flu in the community. Then we will see the treatment of swine flu and why we should take flu and swine flu so seriously. First of all, let's see what is flu and swine flu. Flu is an infection of the upper respiratory passages caused by a virus called influenza virus. This influenza virus has many types causing different types of flu. So there can be a regular flu which occurs every year during the winter season. It is caused by typical influenza viruses A or B or C types. Then there is bird flu that mainly occurs in birds, especially chicken. It rarely crosses to humans. However, a few years ago in China and Hong Kong and Saudi Arabia, we did see some cases where the bird flu affected human beings. The third type of flu that we will talk about in detail is swine flu. The word swine means pig, so it is also called pig flu. Mainly occurs in pigs. Once it occurs in humans, human to human transfer of virus has become very common. So to recapitulate, swine flu is a type of flu that occurs due to a virus that mainly lives in pigs or swine. Transmission of this virus from pigs to human or humans to pigs is not clear. We don't know how it travels from one to another. However, once the virus reaches the human being, transfer from one human being to another is very common. So since flu is a type of flu, whatever I am going to tell now in this presentation also applies to regular flu, also called simply the flu. Both the flus are very difficult to differentiate, but there are some differences which I will mention now. First of all, most important is that both the types of flu can affect anyone. However, swine flu attacks younger adults more frequently. So people who are in the age group, say between 10 and 35 or 40, swine flu will more commonly affect them. Compared to that, a regular flu affects old people who are more than 65 years of age or people who are very young, like children below 5 years of age. The significance of the fact that swine flu predominantly affects younger people is that if there is a flu epidemic, the society can suffer severely because young people are the breadwinners. They work in factories, in schools, in banks. So all those will be affected. So swine flu can slow the economy of the country much more than a regular flu if we have equal number of patients. Another difference is swine flu patients may also have abdominal symptoms like nausea, vomiting, diarrhea, loss of appetite. These are not the features of regular flu, but this is not a must that each swine flu patient should have abdominal symptoms. That is not a must. But if abdominal symptoms like nausea, vomiting and diarrhea are present, it is more likely to be swine flu.